Hi guys, a lot of you have been asking me to make a video on bipolar disorder, and this weekend I decided to compile a few notes on bipolar disorder. So today we're gonna talk about what you guys have been waiting for a long time. And I am Cecilia Akadum. Just call me C, as in the letter C. And what is bipolar disorder? It is a mental illness that is classified by its extreme highs and extreme lows. It can really affect people to the extent that it changes your sleep pattern, it changes the activities that you do, it changes your way of thinking. So in general, it changes your behavior. This is what bipolar do. So in a nutshell, it changes your behavior in a negative way. What I want people to understand is that there are two main types of bipolar disorder. We have bipolar 1, which is mania. That's what we call it. We call it mania. And then we have bipolar 2, which is hypomania. Now, let's talk about bipolar 1, which gives the manic symptoms. So, bipolar 1 can make a person irritable. And these manic symptoms is almost all day, every day, for 7 days or more. So, the next symptom is distractibility. And what is distractibility? It simply means the person is distracted throughout this period. That means they cannot sit still and they cannot pay attention to anything. So they are completely distracted during this period. So another symptom is what we call impulsive behavior, which means they cannot think through things. They are always making rash decisions. Because of this, they always land themselves into troubles. So the next one is grandiosity. And what is grandiosity? It simply means inflated self-worth. So during this period, they see themselves as superheroes. Sometimes they even see themselves as God. Because what happens during this period is that they think they are better than everybody on this planet. So this is what we call grandiosity. So the next symptom is they get flight of ideas. Okay, so during this period, they can get a lot of ideas, but none of them make sense. Okay, so what happens is that within a short period of time, they can give you all sorts of ideas. I mean, loads and millions of ideas, but none of them make sense. And this is what we call flight of ideas. And the big one is sleep issues. Around this period, they don't sleep. I mean, some of them can even go for about 4 or 5 days without sleeping. And when you ask them, they tell you they are fine and they don't need it around that time. What I want people to understand is that mania, which is bipolar 1, can be caused by medical issues, such as when you have a problem with your thyroid gland, you can have bipolar symptoms. Temporal lobe seizures, traumatic brain injury, and even some steroids can also cause bipolar 1. Cocaine, weed can cause it too. Sometimes mania can lead to psychosis. Now, let me take you through bipolar 2, which is hypomania. And people that suffer bipolar 2 exhibit the same symptoms as bipolar 1, but theirs is not as bad as bipolar 1. So the only difference is that bipolar 1 is extreme And bipolar 2 isn't as bad as bipolar 1, if you get what I'm trying to say. And the length of time is normally 4 days, but with bipolar 1, the length of time is normally 7 days or even more. But bipolar 2 is only around like 3-4 days, and they are okay. The difference is that there is a depressive phase in bipolar 2. Bipolar 1, no depressive phase. But bipolar 2, there is a depressive phase. And their depressive phase can be quite a bad one. Things like not wanting to do anything, always wanting to stay in bed, and they tend not to have any interest in the activities that they used to like. And in extreme cases, they feel suicidal as well. What I want to emphasize is that bipolar people can also have a normal life, just like you and I do. Okay? Sometimes they can even go for like 6 months without any symptoms at all. Okay? That means they can work just like you and I do. They get married just like you and I do. The only thing is that we give therapy sessions, or we make the partners understand that this is what their partners are going through. And most of the times, the partners are fine. They are okay with it. So do not look down on people with bipolar, because they can have a perfect life. They can have a normal life just like you and I do. And if you have a partner with bipolar, you have to know how to treat him or her. You have to know their triggers. You have to know a lot about these people. So in the next video, we're gonna talk about how to help people that suffer bipolar, the triggers, and what to do when you see the symptoms.
Unbreakable. It's possible to rise again.